Right. Good afternoon, good morning, good evening to everyone. Thanks for joining us today on another episode of the EHA Insights webinar. My name is Juliet Odogu. I'm the Executive Director at eHealth Africa. So thanks again for joining us on our Insights webinar series. For those who are either joining us for the first time or not very aware, Insights is a public health webinar series that's hosted by eHealth Africa, primarily with the purpose of fostering conversations with like-minded professionals within the public health space and really using those insights to advance the work that we're doing collectively. So I'm happy to welcome you to, I think, the 10th episode of our Insights webinar, and I believe it's going to be a really fantastic conversation today. Today, the topic or the focus for our webinar is achieving gender equity in digital health practice. I think most of us can all agree that gender inequity in digital health has persisted in spite of multifaceted efforts to address this recurring challenge. Digital health inequity has many far-reaching consequences for the economy, for public policy making, and especially on health outcomes. We already know that women face multiple barriers in accessing healthcare services, including gender-based discrimination, limited financial resources, as well as social norms that sometimes prioritize the health and well-being of men over women. And these disparities can lead to some significant health outcomes, like I said, including the increased rate of maternal mortality, untreated chronic conditions, as well as a reduced quality of life. In addition, we know that digital health solutions can either be a critical enabler or a blocker in some cases to accessing quality healthcare and to strengthening health systems. And so it's really important that we look through the digital health lens and identify ways to address, whether it's either worsening the gender disparities or bridging the divide as we work towards this goal of achieving gender equity and improving the health and well-being of all individuals. Today, we have a very interesting array of panelists that are here to discuss this very topic. I'm really excited by the wealth of knowledge that we have in the virtual room today, and I really do hope that we can glean some very useful insights from their collective experiences. As part of the conversation today, we'll also be taking questions and answers, so please use the Q&A function of the Zoom platform as opposed to the chat function. So for questions, please use the Q&A platform, and we'll be taking questions, after we've gotten a chance to speak to our panelists in some detail. All right, I'll go ahead now and introduce our guests for today. Starting with our first panelist, Evelyn Castle. I'm very delighted to have Evelyn Castle with us today. Evelyn Castle is the CEO, currently the CEO of EHA Impact Venture, but also, one of the co-founders of EHA Foundation. And so, has been really driven and has been really impactful in the work that we've done at EHA over the last more than a decade. Evelyn Castle is a pioneering health executive and impact investor. Having, like I said, spent more than a decade working in the health sector in Africa, she is now committed to building Africa's impact investing ecosystem, now with the specific goal of supporting female-owned small and medium-sized enterprises. As a co-founder of 3 social ventures, that's EHA Clinics, and EHA Impact Ventures, Evelyn brings to this conversation vast knowledge and expertise from her role of supporting small and medium-scale enterprises, as well as really working to bridge the gender divide in development. So Evelyn, really glad to have you here for the conversation today. As I introduce each participant, I'll give you just another minute or two to highlight your experiences, as it relates to the kind of the topic that we're discussing here today. So over to you, Evelyn.
Yeah, thanks so much for the introduction and for having me on this panel. It's obviously something that is incredibly close to my heart, looking at how to increase gender equity in the development space. So I'm really happy to get to participate. Thank you.
Fantastic. The next panelist I will introduce is Rose Nzioka. Rose is the country representative of Palladium Kenya and the co-chair for the Global Digital Health Network. She is a seasoned public health professional with more than 20 years experience in supporting public health and health informatics interventions in various capacities in Kenya, South Sudan, Zambia, and Swaziland. Also working with ministries of health on projects funded by the USAID, CDC, UNICEF, Helen Keller, Caritas International, amongst many other donors. So she really brings to us today a wealth of experience implementing public health projects, health informatics projects, and can share her expertise around how to ensure that we continue to build that gender equity. Thanks for being with us today, Rose, and please feel free to highlight more on your experience here.
Thank you very much for the introduction. Good morning, good afternoon, good evening, everyone. My apologies, I'm having a technical hitch with my video, but I will work on that as we proceed with the call. I'm really delighted to be on this call. Digital health is an area that is part of my passion, and I have spent the last over 15 years in this field. So I really look forward to the conversations that we'll have this evening. Thank you.
Great, thanks, Rose. Up next, I will introduce Moturayo Opayinka, who is the CEO and founder of Women Novates in Nigeria. Moturayo is also a pioneering tech executive who, after having spent many decades working in tech, both internationally and in Africa, she is now committed to building the Africa tech ecosystem with the specific goal of closing the gender gap and increasing female participation in STEM fields and sectors. Moturayo brings, again, vast knowledge and expertise to her role in service to the mission of supporting women in STEM. She is very passionate about education, technology, innovation, business ecosystems, and the enabling environment that sponsors their growth. I'm happy to have you on this chat today, Moturayo. Please give us further introductions.
Yeah. Thanks, Juliet. It's a privilege to be here today. Obviously, gender equity is one that is very, very important. We know that the gender gap is one of the issues that's plaguing our world today. So our mission at Women of It is to help close the gender gap, to have more women participation and inclusion in STEM sectors. So I look forward to the deliberations we'll have here today. Thank you.
Awesome. I'm also really delighted to have at least one male perspective on the panel today to really give us a balanced view for the conversation. So I'm happy to invite Emeka Chukwu to be on the panel as well. Emeka is the Senior Digital Health Advisor at Health Enabled and has about 2 decades of digital health experience. Before joining Health Enabled, Emeka provided digital health consulting to multiple UN agencies and nonprofit organizations, really around supporting strategy development and solutions implementations. Emeka is also a PhD research candidate with over 20 digital health publications, and is also a casual lecturer at the Computer Information Systems Department at the University of Malta. So really excited to get your perspective on this critical topic as well. Thanks for being here, Emeka.
Yeah, thank you very much, co-panelists. Thank you, Juliet, for having me on this panel. Really excited. I've been exposed to the world of finding equitable capacity for Africans and specifically women in the last 2 years, even though I've been in digital space for a while, but then working with colleagues in the last 2 years has exposed me to those, and I'm going to be sharing a lot on this today. Thank you.
Thank you so much. And then last, but certainly not the least, we're also joined by Dayo Spencer-Walters. Dayo is USAID Global Health Security Advisor at the US Embassy in Freetown, Sierra Leone. She has worked in Sierra Leone for nearly a decade, managing several research projects and programs ranging from adolescent mental health, emergency preparedness and response, really focusing on Ebola and COVID-19, supported vaccine clinical trials, community health system strengthening, and emergency supply chain. And a common thread throughout her work has really been around the development and or scale up of digital health solutions in Sierra Leone. We're really happy to have your perspective here today, Dayo, and thanks for joining us.
Thank you. Happy to be here, Juliet. Thank you for inviting me. I do have to say that I am here in a personal capacity, so the views that I express will be my own personal views and not necessarily those of USAID or the U.S. Embassy in Freetown. However, another important thing is I am an eHealth alum, woo woo, go me. And also, I'm one of those people, I am very passionate about gender equity. But I have never really, had that type of role. Instead, I'm the type of person that will usually try and incorporate it somehow into the work I do, which I still think is an important aspect because a lot of people aren't in, specific roles that are for gender equity. And gender equity isn't tied to just a specific role or organization or anything like that. So happy to provide my perspective. Thank you.
Fantastic. Fantastic. I think that's a very important distinction to make, that you don't have to be specifically in that role to really make a difference. And I think that's why we have the diversity of the panel that we have today. And I'm sure that, the audience can see that we have very seasoned experts in the room. I'm really hoping to draw on a lot of their collective experience. And this is also a reminder to everyone to please drop in your questions in the Q&A function of Zoom. And, hopefully we can really enjoy the session. Okay, so we will dive right into the session and, I think we should start with some kind of level setting to really understand, what is intended when we say there's this gender inequality in digital health. What does that really mean? What are also the consequences of having this inequality, and how do they start to impact or affect women's health outcomes? And I will pose the first question to Rose, because I think, with the breadth of your experience with implementation, you can really shed some light on how this shows up in public health programs and digital health programs.
Thank you very much. So I think really when we talk about equity, we are talking about disparities in levels of access, utilization, levels of knowledge, even understanding of digital solutions and digital enablement. And really there are barriers that are gender-based, there are other types of barriers. But for the conversation today, we're really focusing on the gender-based barriers. And I think some of the consequences of not achieving gender equity, really one of the consequences is that women's health needs are not necessarily parity with male health needs. Women have unique health needs, they have unique experiences. And therefore, if solutions are designed while not taking into account women's health needs and experiences, they can be appealing to a different segment of the population. Again, also user journeys are different. Even when you go to a clinical setup and you look at how a woman accesses health services, you will find uniqueness in their experiences, even as regards to privacy and confidentiality of how they access these services. For example, when you look at a simple thing as taking an injection, there are places in the rural setup where that's not a big deal when it comes to the male population, where that is set up. But when it comes to a woman, you will find that privacy, confidentiality of spaces, etc., when service delivery is being offered is of key and paramount importance. So women experiences and needs are different. And that's why, it's important to focus on how can we bridge this divide? How can we reduce these barriers? The other thing is that a lot of the times when we are collecting health data, really a lot of this data is not disaggregated by sex. So you will find that data is together put into a pool of data. And if it's not disaggregated, and remember we have said women's needs and experiences are different, it means you're viewing this whole universe of data that is not, that does not take into account the unique needs of this woman, if you subject it to novel tools such as artificial intelligence, machine learning, etc., such tools are very good when, they use the data that you train the models on. So whether that data is good or it's not, the model really cannot decide for you. If you give it data that is not disaggregated, it will analyze that data for you and it will give you output. Now the output it gives you will have biases in there. And there are nuances that you'll have lost because, like we said, again, women's needs and experiences are different. And therefore, if that bias is perpetuated from collection to how we analyze this data, to how now we package this data into information products that help us to make decisions, it means we are making decisions based on data that does not take into account the unique needs of that of the woman population. Again, if you think about something as simple as, collecting data, if you're in a health facility and you're collecting data with a mobile application, and you're collecting this data in a way that, let's say you're releasing this app to women and you're expecting them to answer questions such as questions on matters that are considered private. Things like monthly periods, things like regularity of sex, things like sexual partners. If this woman does not feel safe in the privacy and confidentiality of this data, she's unlikely to give you the information that you're looking for. So you are likely to pick biases in how the data is being collected because of the nature of the data collection tool or even the nature of the data collection process. And therefore, all the more why we need to think about how can we engage women, even in the design process. How do you design with the woman in mind? If you look at, for example, things like even how content is released out, research has shown us that when women are faced with content that has a female image as compared to a male image, the reception and engagement is different. I don't know why that is so, but it is so. And unless we admit that, and unless we take that into design aspects of tools, it means that we are going to be releasing tools that are not engaging the target audience that we are, that are leaving a certain segment of the population out. When you look at even within the female gender, in there are aspects of inequality, or lack of equity. For example, for a woman who is educated post-secondary school, compared to a woman who has not accessed basic education, their experiences and aspirations are different. Therefore, when you're designing tools, you have to look at the inherent segments in there within that gender pack and not just say that is for the entire female population, but look at what are the segments within this population. What are the cultural biases, demographic biases, experience biases, education biases, etc. And unless we take cognizance of this, you will find tools that are only reaching a certain segment of the population. And that affects health outcomes because eventually we are expecting to bridge this gap so that we have improved health outcomes in the end. Thank you.
Thank you so much, Rose. I think that's a fantastic way to summarize the multifaceted nature and the consequences of really this gender inequity in digital health. I think it could be difficult to pinpoint where it shows up, and I think you were able to just show us, it shows up in the health services. It also shows up in the health data. It shows up in the way tools are designed, even the images and the description used in designing some of those tools, because I think it's really important to be able to categorize how all of this inequity is showing up. I think this leads me to then asking the question to some of our other panelists around what can organizations as well as governments start to do, or start to take into as key considerations when implementing digital health programs and designing digital health solutions to ensure that some of these challenges that Rose has alluded to are not missed or are really fully put at the forefront to improve those health outcomes. So I'll start with Dayo, if you can share your perspective on what are some of the things that organizations should really be looking out for.
Sure. So, I think with organization and governments, one of the things, that they're supposed to do, especially governments, is to create an enabling environment. And that's usually done through policy, through priorities, through strategies. And so an example in Sierra Leone is the recently passed Sierra Leone Gender Equality and Women's Empowerment Law, which has a mandate of representation. So 30% of, civil society organizations, public sector, private sector, even, embassies, consulates, et cetera, have to have 30% of women in their employee structure. And that's a good starting point. It also stipulates like leadership as well. So it's not just, you have a management that's all male and then all of the workers underneath are women. From the organizational standpoint, I think with USAID, for example, has both a digital access and technology strategy, but also a recently relaunched gender equality and women's empowerment policies. And what that does is it sets up a framework to operate, but also direct resources, direct investments and money, things that are important to push these things forward. I think the other thing that governments and organizations should be looking at is infrastructure, right? So developing infrastructure, laying down connectivity, especially in the African context, especially West Africa. And so what does that mean? That means connecting spaces. We're talking about schools, we're talking about hospitals, and also connecting areas that are marginalized and vulnerable, rural areas, areas that are more likely to be disadvantaged by not having as much access to digital infrastructure. I think one thing to also remember is that yes, access to digital solutions, digital tools is very good, but digital, as we've seen, digital platforms can also be very exploitive and can, replicate unsafe spaces for women and for girls. And so I think it's important for organizations, for governments and regulatory bodies to put in safeguarding mechanisms so that these digital platforms don't become just another platform for gender inequality, not just access, but things like gender-based violence and other things that harm women and girls. So I will stop there. Thank you.
Thanks, Dayo. And I think even that last point around making sure that the digital solutions don't mirror the fractured or frayed environments that we have in the physical spaces is really important for not just the government, but implementing partners to be aware of. I think something that you mentioned that maybe I want you to just expand on a little bit is that there may be a role for the donors in terms of investments and even accountability in ensuring that some of these things are happening. So can you speak more to what role the donor space has in terms of just making sure that this divide is paid more attention to?
So I think one responsibility as donors internally is stepping our game up so that we actually can understand what's happening in the digital world, and be able to understand, have the capacity and technical expertise to monitor and to understand the impact that these solutions are having or are not having. It's not necessarily just enough to give out money. Like, we need to understand what it is that we're doing and what it is that we're doing is impactful. And I think with digital solutions, that's different than a program, a workshop or traditional programming. So I think that's one thing that organizations need to do. Again, I mean, I think in terms of focusing on policies, focusing on understanding what that means in terms of implementation. With USAID, many of the larger offices, larger missions have gender advisors, they have digital advisors who are looking for opportunities for investment, who are giving advice about programs and how to develop and design programs that are inclusive. So I think those are some of the things that can be done in that regard.
Yeah, I think that's fantastic. I know, Rose, you wanted to add something, and then I'll also get Emeka's perspective on this topic.
Yeah, I just wanted to add that I think there's a role for private sector to play here, especially in the design process. Private sector is very innovative, and they're able to turn around solutions very quickly. I think one way they can help in this regard is to engage the user in mind in the design of solutions from the word go. You know, this statement that says design with the player in mind, so that you're not designing a game that will never be played, but engaging the users who are women in different segments of the disaggregations throughout the user process. And I think the other role also I wanted to add is government has a big role to play in terms of data governance. You know, setting up the policies, the regulatory framework, the regulatory steps in ensuring that there's governance in the data that is coming off these different tools. And this would ensure that privacy and confidentiality is taken note of from the design into the implementation and rollout of these tools. Thanks.
Thank you, Rose. Some very good perspectives there. You know, even as we talk about privacy and confidentiality and designing with the users in mind and, you know, inclusive design, I want to hand it over to Emeka, both to talk about how organizations can, you know, contribute to this, but also how can we approach design of digital health solutions in a more inclusive way or in a better way. So you just kind of give us your perspective, because I know you have designed and developed a number of digital health solutions in the past.
Yeah, thank you very much, Juliet. I would start from the organization's perspective. So last year, in 2020, WHO launched her digital health strategy, global digital health strategy. And there was elements of gender included in that strategy. And last year as well, Gavi also launched her digital health information strategy. And they had a very significant mirror or interest and picture of how they want to make sure gender is included in how they do their programming. And the strategy was supposed to guide countries in, the Gavi one, because I was fortunate to be part of that work, supposed to guide countries in how they make requests for digital interventions. What it means then is that you're making requests in future and you want to request technology intervention in healthcare, then you have to put in a statement or two of justification how you think you will use, you will ensure gender balance in, and I think that's the big step, because if you look at the country level, most countries' strategies that I've looked at have not given a lot of emphasis or any emphasis at all to gender lens when it comes to strategy or roadmap work. And I think it's something that a lot of advocacy needs to help address. And these two global organizations are leading the way in this happening. And of course, we expect that more will follow, and there may be more already, but I'm just giving examples of two that I already know. Now, the second thing I wanted to talk about at organization level, at global level, is toolkits. Organizations have developed toolkits. I know UNICEF developed a toolkit specifically for making sure you consider gender in your programming. But since we are talking about digital, Gavi developed a toolkit to help you mainstream gender for digital when you are maybe working on country level roadmap for digital health and immunization and PhD. So these are areas, this will help countries bootstrap their effort, because even when you're having conversation around gender with digital health colleagues with a lot of experience, it's a new area. It was a new area for me in the last 2 years. So I just learned, and I think such toolkit will come a long way to help. Then to address the issue of designing with the user, and I would say without belabeling it, yes, we know that there's a gender gap in terms of developers and maintainers of digital health interventions. But we may not be able to fill all of that gap immediately. But what we must do at a minimum will be to make sure that any tool that gets designed should at a minimum be tested with women or users, especially tools that are provider facing or public facing. While you are planning to test, make sure there is users who come with women perspective, or at least women should be involved in the testing process. Over. Thank you.
Thank you very much. I don't think that can be overstated in terms of the participatory and inclusive design process at all levels. I think, you know, the fact that you keep alluding to that is really helpful. Also very helpful to see some of the impacts, especially around toolkits, because I think that's an easy way for any partner, any government who has the intention to really be inclusive in their programming and policy making, to have handy resource materials and to have a framework to follow. So having those toolkits, very, very helpful. And I think one tangible way that we can say global organizations or global partners are really putting their investments where their mouth is. Even the conversation around being able to justify or to showcase, even from the program design or even from proposal design or RFP design process, how the solutions that organizations be building contributes to, you know, bridging the divide is really helpful. And I think that will also push partners to continue to be more intentional about their design. Daya, you want to chime in here?
Yeah, I just wanted to add, you know, I think especially organizations, governments, it's very important to listen to civil society orgs, community-based orgs, because, you know, a lot of times that's where they have already formed what the government needs to do. You know, it's really at that point a negotiation process. I can say for the gender equality and women's empowerment policy in Sierra Leone, you know, that was passed by government, but it's really a victory of civil society. I mean, that was a 10, 15-year push, you know, to finally get government to do something about the lack of female representation, you know, in decision-making bodies. And so I think listening to civil society, engaging with civil society is very key for organizations, key for governments, because that's really where we start to see what, you know, how people are defining equity and what their needs are, and what solutions they're proposing, you know, versus trying to design something based off of what we feel is needed. So I just wanted to add that.
Yeah, that's very timely. And shows that we have to be engaging the stakeholders at all levels. Really, if some of these solutions are also designed with the top-down approach in mind, we're probably going to be faced with tools that are not fit for purpose and tools that again are continue to exacerbate the inequity problem. One of the themes that have been mentioned throughout this conversation, even from the beginning, was how this shows up in data, from data collection to data disaggregation or aggregation and data use. And so we know that data has a big role to play in how we address this gender inequity. So I want to come back to you, Dayo, again, to really just talk more about how we can leverage data to identify and address some of these disparities in health outcomes, and really even focusing on underserved communities. How can we start to use data for better decision-making there?
Thank you, Juliet. So, I mean, I think the first step is how the data is generated. You know, one of a main buzzword is, you know, participatory research, community-led research. And I think those things are very popular. I think there are great mechanisms, but I think it's important to be genuine about it. You know, I think participatory research, one can be more investment heavy. It may require more resources, more time, but it's one of the ways to really work with the beneficiaries to develop, you know, data that is then understood, ideally by community members, and taken on by them to make informed decisions about what their needs are, and develop intervention. So I think, you know, that's really key. And, you know, initially it was kind of this, okay, we'll just, you know, stakeholder consultation at some point, either at the very beginning or at the very end. But as, you know, my colleagues have been saying, that's not enough. It has to happen throughout the generation of the data, the analysis of the data, the interpretation of the data, which is key. And that requires long-term investment of women of color, people with different perspectives, so that they're in those positions to have the skills to analyze the data and interpret it. So I think, those are really important examples. I think the data itself is a way, disaggregated data is like Rose was saying, is very important. And also putting gender on data. So a lot of times, we'll talk about things like the health workforce, not realizing that the majority of the health workforce is female, right? Or in emergencies, when you're talking about frontline responders, you're talking about clinicians at the community level, most of the times those are women. And so putting that lens then sheds a whole new light on what we're looking at and what we're talking about. When we're talking about, I can speak for emergency response. During an emergency response, clinicians, frontline workers are more likely to be infected with whatever the infectious disease outbreak is. They're more likely to have higher mortality, higher morbidity. When we're talking about that, we're talking about women, right? And so that has a whole new outlook on what we're saying. We're saying that during emergencies, women who are more likely to be caregivers, more likely to be, people on the front line, are getting sicker, right? Are more likely to catch whatever the outbreak is, and more likely will have long-term negative consequences of that. So I think when we say things in that way, it sheds a new light, on the inequity, on inequalities, and on gaps that we need to address. Another example, sorry, my experience is emergency response, so it's emergency response, is government signed on to a tool from WHO, which basically looks at a government's capacity to respond to an outbreak. And recently, WHO, through consultation with a lot of other stakeholders, added indicators on community engagement, but also gender. And what that means is, now tracking who's making decisions about emergency response, who's being trained, right? Because a lot of times we'll see the people who are being trained aren't necessarily the same people who are on the front line. And so when we use data that way, I think it sheds light on the story, and it also helps us understand where those inequalities and inequities are, and where we can make changes to start to see differences. So I will stop there. Thank you.
Thank you, Dayo. I think even just the concept of data, I think is one thing, but this is a nice segue into talking about the workforce, because I think you've highlighted the fact that there's that imbalance in the workforce and in the capacity building and considerations for the workforce, which is usually largely female. And so, what can we do better in that regard? I want to, throw that both to Emeka and Muturai, or even to come in from the private sector perspective. How can we, continue to increase the consideration and representation of women in digital health at all levels, at all cadres, and then particularly in leadership, I think, as we start to see where there's more influence. So what are some of the things that have been successful? What are some of the challenges that we still have to surmount in this area?
All right, so I think I'll take that. Thank you very much, Juliet. So from the private sector perspective, I think, there's only so much government can do. We all have the responsibility as well as government. Advocacy is very key. We need to have more women in leadership roles. We need to create more, keep creating awareness so that, policies that are being made by government are taking into consideration the need that there has to be full representation. Particularly in all, the STEM sectors where, we find huge gaps, advocacy to deal with the biases and the norms that, are actually deterring, the female gender more into education, skills development, a lot of developmental work needs to keep, to be ongoing and to shed light, and obviously around the monitoring and evaluations, just to ensure that, the indices are showing that, changes are being adopted. This past election, we actually found a woman governor being appointed. I don't know how that's come out, because that result was being disputed, and I hope that doesn't happen, because even the announcement that a woman won a seat as a governor in Nigeria was one that was very much welcome. So advocacy just has to, carry on. Capital investment into the education sectors by the private sector as well as government, also very equally important. I particularly find myself within the digital economy committee with NIDA, and it's inspiring to see, that they have made room for quite a number. In fact, in terms of the constitution of that committee, it is 70-30, 70 to us, women, representing, various areas that are required: policy writing, frameworks, stakeholder management, and just ensuring that, where there's full representation into those policies that are being written for government to adopt. So this has to be ongoing, and surely we'll get there. We start seeing these results with time. Thank you.
Thank you, Ms. Yeah, Emeka, please go ahead.
Yes, thanks. I'll just follow on from where my colleague stopped. That Health Enabled is the Secretariat for Global Digital Health and Maturity model, a model for determining a country's maturity when it comes to enabling environment. I just wanted to add that the 19 indicators, when this was launched in 2018, when we were reviewing it last year, one of the key indicators that we added was to find out if a country's national digital health strategy has consideration for gender. And we do think that that will help elevate the conversation to bring in gender discussion, even when countries start to work on reviewing their national strategy or even developing new one. So that's stayed on the data side. On the in making sure that more women are included both at technical stage and then up to leadership stage. I do think, and this is my own opinion, that we have to be intentional about the awareness we create about STEM education. And I'm using an example of my daughter. She comes home, tells me, "Oh, Daddy, I was told that mathematics is difficult." So who told you that? And then when we had several conversations, 2 years down the line, she's leading in math in her class. And so some of this conversation needs to be, and it could be as a result of some biases that we're already used to. And then the teachers in school speak it to the children, and then the whole thing just spirals out. So we have to, as both countries and civil society, advocate, engage in dispelling some of this conversation, saying, okay, engineering is for these specs and all of that. We have to be intentional about that. So I do think STEM admissions needs to be looked at, and intentional countries be intentional about how they are they admit and who gets admitted, and even advocacy around that. Over.
Thank you so much, Emeka. Evelyn, did you want to add on to that?
Yeah, sure. Just to expand on that too. One of the big challenges that we have seen a lot is around equity in entrepreneurship too. So in entrepreneurs that are creating tech companies, again, this can get a little bit depressing sometimes when you start just like adding on and everybody's saying all of these issues. we know that less than 1% of financing for all startups goes to women founders. And we know that most of the time men are going to solve problems that they're aware of, like healthcare problems that they're aware of, and women are going to solve healthcare problems or healthcare challenges that they face. And so really making sure that women are getting the same access to these entrepreneurship opportunities or these finance opportunities so that they can create companies that are developing, digital health solutions or just health solutions in general to improve healthcare for women. And it's been great that the whole femtech movement has been gaining so much speed over the last couple of years. One of the kind of more common examples that we hear a lot about is Clue, which is a period tracking app from somewhere in Europe. But yeah, like most women have some sort of adverse reaction to hormonal birth control, which was created by men, and eventually said, you know what, like we don't necessarily want to only have the option to take hormonal birth control. There's other options out there too, like around natural family planning. And so Clue is a period tracking app that, helps them to look at the option to do something like that. But the cool thing is that these are all popping up in Africa too. A great example that I like to talk about in Nigeria is WISPA Health, which was founded by this amazing woman who saw the problem that a lot of women are not getting, women and young people are not getting tested for STIs because it's embarrassing. Nobody wants to go to the doctor and ask for an STI test. And so, she built a company that allows people to get those resources discreetly. So again, just getting women in leadership positions, in founder positions is really going to help us gain that gender equity.
Thank you so much. And a nice segue, because one of the things I want to kind of put back to you as now kind of in this impact investment space and understanding kind of the economic benefits of supporting women entrepreneurs and women-owned businesses. Can you speak to, I think we all kind of talk about the benefits, but kind of speaking to the thread, what's the connecting thread between this kind of investment and the benefits to what we're talking about here with improving health outcomes and improving general well-being of women and the community. So just kind of helping us connecting that from the private sector and impact investment angle to basically the public health or development benefits.
Mm-hmm. Yeah, it's super interesting to see that there is such a direct link between a woman's access to capital and to finance and to her health and the health of her children and her extended family. You increase a woman's capital, you're going to increase her general health and well-being. And, you look at that because there's a couple different factors that go into that. Health isn't just about being able to get access to a doctor. There's the socioeconomic factors, like I talked about, is just like her access, her ability to pay for it. It's the physical environment. Is she living in a super polluted, dirty area because she's low income, or for whatever other reasons? Health behaviors. Does she smoke? Is there sexual or abuse in her community? And then yes, of course, like, does she have access to quality healthcare? So all of those things, influence her, a woman's, general well-being. But I think the socioeconomic one and her access to capital is such an interesting aspect of it, because we know that women invest 90% of their income back into their families. That's like almost all of the money that they make goes back into their families. If I'm guessing you can take a guess how much it is for men. It's 35%. So men only typically invest 35% of their income back into their families. So again, making sure that women have access to that capital and that money is really kind of like the most sustainable way that we're going to see large scale improvements in healthcare over time.
Yeah, thanks. I think it's so helpful to connect those. And it really goes to my next question of how do we start to measure it? Because when we have these tangible data points, we can see that, there is a direct benefit to, investing in women-owned businesses or to designing digital health solutions with, gender equity at the forefront. So I really want us to kind of talk through how do we start to measure, what are the benefits and how do we start to measure them? Motunrayo, if you can just kind of chime in on, how are some of the ways that we can measure even the economic benefits of improving the gender inequity in digital health.
All right, thanks, Juliet. So we know that, achieving gender equity in digital health practice obviously will bring about a lot of economic benefits around economic growth, productivity, and overall profitability, because obviously the statistics have shown that companies with gender diverse boards, are 15% more likely to have higher financial returns. There are immense benefits in achieving gender equity. Beyond that, improved innovation, increased workforce diversity, and then just like we've been chiming from the start of this discussion, we have innovations that more innovations that will be tailored to the needs of the woman, and better health outcomes. So how do we then start to measure these benefits? We can start off by measuring the returns on those investments. Usually women businesses, just like Evelyn mentioned, they have barriers to funding. Female founders, in the startup ecosystems found, they're not, in terms of access to funding, it's, compared to the male counterparts, it's actually less and second to none. But yet we know that female-owned businesses do really well. So we need to tackle those barriers so we can start seeing more investments open to female entrepreneurs and founders, and obviously, using indicators like the returns, return on investment, measuring, the return on those investments in, businesses and companies where they've gained that gender equity is an indication of, some of these economic benefits. Beyond that, I know there's some indices around, some companies that are best to work for in terms of where they've attained gender equality and equity. You measure things like employee satisfaction and the turnaround, the churn rate and retention of employees. So it's measuring employee satisfaction, their retention rates, will also be, an indication of the economic benefits of gender equity. I know there's a study conducted by Deloitte, which found that, inclusive teams actually outperform their peers by 80% in team-based assessment. So, generally, these are the main tools that we can start using, to measure the economic benefits of gender equity, especially in the digital health sectors and, also other sectors. And, outcomes of this can, will aid improvement in ensuring that, companies aim to do that. Everyone is, adopting and ensuring that equity is embraced in every facet, every part of our existence, so that, we begin to see, the economic benefits, not just in the digital health practice, other sectors overall, and we will start enjoying the benefits and the outputs of these benefits. So for me, those are the two major ones for measuring the economic benefits. Thank you.
Thank you so much. I think it's important to reiterate that if we're not measuring, we don't know how successful we're being or how large the problem still remains, to be solved. So it's important that we're not also just measuring it from the health outcomes perspective, but also from the economic side angle of things, because we know that there's a direct linkage. Just a quick reminder to everyone to please send in your questions. I think we're getting a few questions now. Please use the Q&A function on the Zoom chat. We are also streaming live on LinkedIn, and I know that there are questions coming in from there. I want to just ask a question that I've seen coming from LinkedIn, even though we've kind of talked around this. The question says, how do we strategize in minimizing the disparity in healthcare facility settings, right? So I think we've talked about policies, we've talked about, women in leadership, we've talked about so many other things, but we also know that when we get down to the healthcare facility level, that those disparities still arise. And I know we've alluded to some of that. So I'm not sure which panelist feels comfortable, otherwise maybe Rose or Emeka or Dayo can share their perspective here.
I think I can start and then my colleagues can join. I would say, yes, you're right. The disparity is, so we're speaking about digital inequity at the facility level. If you're looking at the data just at the facility level, especially primary healthcare facility level, you're going to get a different perspective, because you probably see that most of the people who are collecting the data at the facility, whether it be digital tool or paper-based tool, are women, because basically 70% or more of those who provide service are women. But then that is not digital empowerment, in that it's just circumstantial that they are the ones. But then you move higher up. I was also speaking to a colleague in one of the states in Nigeria, and I got this perspective that in their state, they have higher number of women who do data work at the facility level, but then you most likely up to the state level, you now have more, less number of women, more men doing the work as M&E officers. So it seems the higher you go, the less women you have in the hierarchy of data and digital systems management. So how do we do this? We just have to make sure we are contextual in how we facilitate gender inclusion, or if we want to be gender intentional, it's not a blanket to just say, okay, you have this percentage, but because then you will have those disparities. Is then to contextualize and know, okay, for designing tools, make sure you do this and just be a bit more intentional across board. So that's my perspective. And another thing too is to something that may be an unintentional consequence of trying to be equitable would be to make it seem like when you do have competent women who can do the job, then because you are trying to fill the quota, you make it sound like they are doing the job because they are women, because this is some inadvertent consequence. And then you introduce an ill feeling of when somebody is competent and doing their job, they don't get the I would recognition for because they are competent. They are just recognized because they are female in that role. So just wanted to say that. Thank you.
Very valid point. Dayo and Evelyn.
Yeah, I mean, I think, when you get down to the primary care level, it's, again, like what Michael was saying, it's women. It's mostly women who are going to the facility, women and children, and then it's majority women who are treating. And I think the big thing, kind of the elephant in the room is always, it's a poor working environment. It's a stressful working environment. It's a very limited, resource working environment. And so you have women who are stressed, who now have to provide services to women. And I think, from my perspective, now that I sit on the donor side, a lot of times we're training, we're providing equipment or providing resources, but we're not actually improving the working environment of the nurses. They're not paid on time, or they're not paid. They don't have adequate wash facilities. There isn't just the working environment itself, it's hot, it's humid. They have more patient load than they can support. They don't have the right equipment. They might have all of these SOPs that, all the partners have developed, and they might have gone to trainings, and they have a brand new spanking tablet that has 10 different apps that they have to enter data on. How are they entering all this data, but also doing, patient care? So I think the working environment has to improve, and that takes investment. And that, I think that can come from a lot of different sources. It's not, it is the responsibility of a government, especially if it's public sector. But I think, that has to improve, and that's what will improve quality of care. A lot of times we're literally, it's very common to say this in the US, but not in Africa, burnout. You're dealing with literally with nurses who are just burnt out. So I think, that we have to look at the bigger picture. And to be very honest, in a lot of cases, digital health in that sense is harmful because it's creating more work, because it's not coordinated in how it's implemented. And so it's not helping the actual workflow and the actual work environment of the clinician in that setting. So I'll stop there. Over.
Mm-hmm. And I think that that's like a really great point from the kind of like the government side of things, but just also to talk about kind of the NGO or the, the for-profit side of things too. Speaking as like an owner, as a boss, sometimes it's a challenge for owners because there's only so much we can do. We can create and put in place, policies or, benefits to try to encourage more women in the workplace, try to help them with some of these challenges. But at the end of the day, these issues are systematic and, start at home. And, there's only so much a boss can do if a woman doesn't have that support system at home. So I think, to be a little bit controversial, there's a point where we also have to say to our husbands and to our male colleagues, like they have to step up as well, because we're not going to get there if women are constantly having to play, do the majority of the housework, majority of the childcare, and taking on all of these responsibilities at work too. It's just we're not going to reach gender equality if we have to keep doing that.
I'm happy that you called out that in a very poignant way, and I think that's worth noting. Rose, go ahead, please.
Yeah, thank you. I just wanted to add to what Emeka was talking about earlier as regards to the number of persons that are collecting data at the health facility is majority female. But when you think about the data value chain, just like he was saying, you will find that the numbers reduce as you go along, and as decision-making space increases, there are less women. So I think it's not about the numbers. It's more about having not just more women, but more women in decision-making space. Because if these women are in decision-making space, if they're in departments that are responsible for making decisions on what digital tools are onboarded, departments that are responsible for making decisions on what data is collected, they are likely to influence, how data collection happens or how design happens. But if they're just collecting and transmitting it along the way, then we lose an opportunity for having the female voice in decision-making. I think also just going back again to user-centered design, I think I don't know about the countries that are represented here, but in my country, there are facilities that have decision-making space to decide what digital tools they onboard for primary healthcare, especially. When it gets to the national level, the government will make decisions. But at primary healthcare, at sub-national level, there's a lot of decision-making room. How about in those spaces, engaging women in the design process, like engaging even in focus group discussions to find out if you're developing an appointment reminder tool, or you're developing a tool that reminds women about their FPs methods when they're due. How about having focus group discussions to find out from them what really is the challenge, what really is the problem, and how in your voice as women can we address it? Because if I was to make a contribution to that, I would not be the best representative to the problem that that woman is facing, who perhaps has to cross many rivers and therefore has a unique experience as compared to where I'm seated. So how about in those spaces, in CBOs, in FBOs, in facilities at the grassroots level where it really matters? How about advocating for user-centered design? And I know somebody said, you know, a lot has been done and sometimes you feel like you're not moving the needle, but I think we have to just keep talking about these things and about advocating for them. And if one person or one facility does that, the needle has moved, however small that movement is. Thank you.
Thank you very much. Every step counts and every movement matters. I'll take one last perspective from Muturai on this, and I think in the interest of time, we can start to wrap up.
Thanks, Juliet. Just to add on to you know, Evelyn's point, you know, it all starts from the home. Advocacy has to be continuous, ongoing, just like Rose said, you know, the discussion must be an ongoing one. A woman has so many rivers to cross, from being a mother, a wife, to a member of a family, a community, then to the workplace. There's so much to, you know, that we're dealing with as women. And just like Rose, Evelyn said, you know, we can, there are cultural biases that need to be stemmed. Not in this part of the world. A woman, there's some culture where a woman cannot even turn to her husband to help her with anything, talk less of telling him that she's burnt out or she needs help, you know. So sensitization and advocacy has to be ongoing. Slowly but gradually we're getting there. We're getting there, and I believe, you know, the discussions has to be, you know, ongoing. Thank you.
Thank you so much. I think even in the interest of that, I want to give the opportunity for any of our panelists to share even at least one success story of how we've seen digital health solutions or, you know, digital health implementations be successful in, you know, in moving the needle or being more inclusive in bridging this gap. So, you know, if there's one success story that you can leave us with, I think that would be helpful to seeing how far we've come. Any of the panelists that wants to chime in?
I'm happy to start. I mean, when I think about appointment reminders and what difference they have made to ANC uptake and the number of babies that have been saved and the number of women that have been saved and the levels of maternal mortality that have been reduced because of just that one type of tool, I think there has been a lot of success in this segment. And I think it's because the pregnant woman is, I mean, a lot of research has been done, a lot of engagement has happened with that segment of the population. So I feel like if that same effort was used elsewhere, we would see outcomes beginning to change. I'm really proud to see, you know, where many countries in Africa are at now with maternal mortality. And I feel like appointment reminders are one small segment or one small tool that has helped in that. And the fact that they have, you know, tools have gone to design in a way that people with feature phones, not just smartphones, are able to access these tools and are able to access these solutions. I think that has really helped. So as mobile penetration is increasing, you know, when we have these tools that are not just useful with smartphones, but are useful with feature phones, I think we are going to continue to see differences in various health outcomes. Thanks.
Thank you so much, Rose. I agree with you that has been a pivotal change in terms of catering to just addressing the issue of maternal mortality and then you know, the conditions surrounding a woman in pregnancy and, you know, post-pregnancy as well. Maybe, because I just saw one other question coming in that's kind of related to here, but maybe a bit more nuanced. Now it's gone. Okay, it's the Q&A function. So this question says, can women menstrual cramps be put into consideration in workspaces? I've seen that as women, especially those in leadership roles, we keep having to prove ourselves every single day. Women get suspended when they miss work due to menstrual cramps because not everyone can relate to it. I think this is a niche problem that I think we need to start thinking about, how do we mainstream, how do we sensitize around? I wonder if there's any of the panelists that would like to share their perspectives on this.
I would like to attempt your first question, not this one.
Okay.
Okay, so you asked about success stories of how countries are trying to mainstream gender. And I saw that Ethiopia is doing something really wonderful in digital health in general, but because they're also having conversation around gender, it seems like they are making progress. They are not yet there, but I liked what I saw when I visited last. So maybe anybody looking should look in that direction. Over.
That's very helpful. I think these examples, go to motivate and then also, act as a guide for people who also have the same intention to be able to look to see what other countries are doing. All right, Dayo, do you want to answer the first or second question?
I don't remember which one was first or second, but the one on menstrual cramps. So I think, it's really interesting because that's an example of, people doing research and people trying to, find solutions or answer questions to things that they're curious about. The thing with menstrual cramps, there's so much research that has come out about menstruating, about premenstrual syndrome, the varying degrees of what women are feeling. And, so many myths have been debunked. There's a lot of research that's showing that menstrual cramps can be as painful as labor pains, right? And so, which that data point alone, like that interpretation alone, then, can trigger, okay, labor pains are pretty painful. You can't work through labor pains, or for the most part, you probably shouldn't. So that then, can create a policy change, right? And so I think there are some, forgive me, I don't know the countries, but there are some countries that are now, passing things or organizations that have period leave, right? So if you're on your period or you're experiencing pain, you don't have to prove anything. You don't have to show your calendar of when you're ovulating or when you're on your period. You can take that time off. But that results from advocacy, that results from somebody doing the research, that results from someone interpreting and then, creating a message. So I think, those types of things is an example of advocacy, example of that research, of someone saying, this is something that I want to know more about, and being able to do the research on it and share that finding over.
Thank you so much, Dayo. And I think this question really was a great example to highlight some of the new ways of thinking that we have to have. And, I'm happy to see Evelyn also put in the comments that Spain has implemented this menstrual leave, and it's something that other countries should start looking at, in addition to other issues that are specific to women and that need more attention. At this point, we do have to wrap up. I know we can probably be here for much longer and discussing the multifaceted nature of this conversation. I hope that the conversation has been, at least insightful for us to see that there is such a thing as a gender inequality or inequity in digital health. Sometimes it's hard to pinpoint or nail down what it is, but I think we've also been able to kind of show the many ways that it shows up. Also show where there's systematic or government-led or policy-led changes that need to be made. I think we've also seen that the workforce is a huge driver, a huge contributor to making this work, being able to have the right kind of people, or mix or diversity of people in the workforce, and making sure that the tools that are being designed are catering to women as well as men, and also making sure that some of the issues around things that are specific to women are being prioritized, are being addressed. Another key thing that I really liked that was highlighted was the more women in leadership positions that we have, the more driven or data-driven decision-making can continue to happen. I think it's also helpful for us to highlight the economic benefits as well as the ways that we could measure that, being able to show what's the return on investment of making this effort, from a financial and economic standpoint, but even also from a development and health outcome standpoint, because at the end of the day, we want to be able to make sure that we're not just kind of talking the talk, but at the end of the day, what we're doing, the work that we're doing has an impact on the lives of, women in various communities at various levels of society. So at this point, I really want to thank all of the panelists for enriching discussions. This was personally very insightful, and I hope was insightful for the audience as well. Thank you so much for your time and your insights, and I hope everyone has a lovely day. This session will be recorded and will be available on our LinkedIn and our website, and you can share this with other people who weren't able to join. And I think the more that we spread this message and the more that we're intentional in our program design and implementation, the more that we can move towards achieving gender equity. Thanks everyone, and have a lovely day.